Hi everyone, we are going to go over some GI disorders, but before we get into the pathology of the gastrointestinal tract, let's first go over some anatomy and physiology. And in this chapter, that is the first learning objective to understand normal GI anatomy and physiology. And if you remember the parts of the body that are important for digestion and absorption, that will help when you're putting together the pathologies. And then we'll get into all of these different pathologies that are going to involve altered absorption, diarrhea, vomiting, constipation, a mixture of both. We call that spastic colon or now irritable bowel syndrome. All of these disorders are going to have sometimes really similar signs and symptoms, but there will always be something really important or different about each of these disorders. So, understanding the normal function is really important, and then picking out special things about signs and symptoms for each pathology. And then we'll talk about some treatment for these things and go over some treatment algorithms as we go through each of these sections. But again, to start out, let's just talk about some basics of the anatomy and physiology. So, the alimentary canal is another term for the gastrointestinal tract. And what you see here on the slide are the main organs of digestion. So, we're going to start up in the mouth, which is important for chewing. We'll go down to the esophagus, the stomach, and then the small intestine and the large intestine. There's also an accessory organ here with regards to digestion called the liver, and that's really important because the liver is going to be making bile. And without bile, we can't break down and then absorb fat products. So the liver needs to be active, making bile for full digestion. And as we go throughout this track, we'll talk about mechanical and chemical digestion. So, mechanical literally means muscle related, so mechanical breakdown of food products. And then we'll talk about chemical digestion, which involves various enzymatic alterations to the food products to break them down into their absorbable parts. So, beginning in the mouth, there is both mechanical and chemical digestion there. The mechanical being chewing, which we call mastication. And the chewing response is half voluntary, half involuntary, but basically is going to involve the teeth breaking down the food and then, with the help of the tongue, moving around and mixing that food in the mouth so it can be swallowed. Importantly, there is also going to be a large amount of saliva that is produced. So that is mainly water. So it says here water secretion. So that will help break down the food into more easily swallowed pieces. And there's also some active enzymes in the saliva. There is salivary amylase, which breaks down starches. And then there is something from the tongue called lingual lipase, and that helps to break down fat. And then once the tongue pushes the chewed up food, which we now call the bolus, up to the top of the mouth, that will start the swallowing process. So it will move down through the pharynx areas and eventually get to the esophagus. And in the esophagus, there's just one long tube of muscle. And there is no real chemical digestion that takes place in the esophagus. Its job is to really make mucus that is a lubricating mucus to help food go from the mouth down to the stomach. And this muscular contraction that happens from one point to the other, from the mouth towards the stomach, is called peristalsis. So, peristalsis is a muscular form of propulsion. It helps move the bolus from the mouth eventually to the stomach. So, no chemical digestion there. The mucus is just lubricating. Then we get down to the stomach, and the stomach is going to have components of both mechanical and chemical digestion. The stomach does secrete a large amount of acid. Hydrochloric acid is a very low pH acid, which is very good for breaking down plant cell walls, so like vegetables and fruits. And then there is another acid called pepsin, and pepsin helps to break down proteins. And we'll see that the term peptic ulcers is referring to pepsin breakdown of the stomach because our organs are proteins themselves. So pepsin can degrade any protein products, including our own. Then there's also a huge amount of muscular mixing that happens in the stomach. It's just called churning. So very vigorous muscle contractions churn the food. At the same time, the acid and water are breaking down the food products from what was first a bolus into a chyme. And chyme resembles like cake batter, is a good way to describe it, or paste. It's something very thin and it's very easily absorbable by the body. So once the products leave the stomach, it should be in the form of chyme. And then at that time, when things leave the stomach, the liver, who has been creating bile this whole time, that bile will be conveyed into the common bile duct and then open up into the small intestine, which is where all the absorption happens. So the liver, again, it's going to secrete, so it's going to secrete into the body bile that is delivered into the first part of the small intestines, the duodenum, which helps break down pieces of fat into tiny little droplets. That's called emulsification. So bile breaks down fatty products so that we can actually absorb those things. The small intestine is the main site of absorption. That's where nutrients are broken down and brought into the bloodstream. So there is also some muscular contraction that helps with that. It's called peristalsis, which we've already mentioned. Peristalsis mixed with another process called segmentation, which is essentially peristaltic contractions around the chyme bolus at this point in time, helps to really, really mix down and degrade that chyme into small, small pieces so that all of the useful parts can be absorbed here. So the small intestine is the main site of absorption. Okay, and then finally, we get to the large intestine, and it's not labeled on here as part of our list because we should pretty much know what the large intestine or colon does, and it's to absorb any extra water. Most of the water absorption happens in the small intestine. Any that's left over will be in the large intestine for that to be absorbed. And the longer things stay in the large colon, the more firm and dry it becomes. So when there is nice normal stool, it means it's had a normal transit time through the large intestine. Really hard, difficult to pass stool, it means it's been in there for usually over 24 hours. We call that constipation. So some important things about the small intestine. Again, it's in three component parts. So once the stomach ends, food, well, at this point in time, we call it the chyme, food will exit the stomach through this pyloric sphincter, P for pyloric, and that pyloric sphincter opens to allow the outflow of chyme. The first part of the small intestines is called the duodenum. It's very short. It only goes from like the pylorus area down to here. So the duodenum is the first part. It is the smallest part, but it's also the busiest part. That's the main site of absorption in the small intestine, which is already the main organ for absorption in general. And then the remaining pieces of this 11-foot coil of lumen are first the jejunum, so you see that in a darker purple maroonish color, and then finally the ileum. And the ileum ends with a small little valve called the ileocecal valve, so ileal from ileum, and cecal from the first part of the large intestine called the cecum, C-E-C-U-M, cecum. So the ileocecal valve opens to allow this really broken down chyme to get from the small intestine into the large intestine so that things can then move through the colon. There's a little piece dangling off of this cecum, and it's called the appendix. The appendix is part of our lymphoid tissue, so it's covered on the inside in lymphatic cells to help prevent injury or infection. However, that can become inflamed, which we'll see in this chapter. So the appendix is on the lower right side of the body. So you have to picture you are looking at a patient lying on a table. So this would be their right side, and this would be their left. So the lower right is the appendix, and then the colon moves up. So this is the ascending colon, transverse, or going across, transverse colon, and then the descending colon. And eventually we get to this little end portion, which looks like an S, that's called the sigmoid colon, which leads to the rectum, which is what fills to initiate the evacuation response. Another thing that's special about the small intestine is that it has specialized components on it, which look like little fingers when you look at them up close, called villi. And here is a close up of one villus, so just one singular villus. And what these do is add surface area, so more area for absorption. So rather than just having a flat wall of the small intestine, like you'll see in other areas of the body, there are these little finger-like extensions. And they're covered in cells that make mucus. So you see goblet cells there. We know goblet cells are important in making mucus. That's pretty much all they do. And then the rest of the things in this area are just going to be blood supply. So there's capillaries, there's arterioles, there's venules, there's lymphatic vessels. And then there is the central thing. If you think of this like a finger again, this would be the finger bone, and that's called a lacteal. So the lacteal provides structure to this villi, or villus singular, and it also provides a direct inlet to this lymphatic pathway. So if things are really big and can't travel, help easily through the bloodstream or enter through these small capillaries, like big proteins and globules of fat, they can enter through this lymphatic channel. So these little finger-like extensions, these are only found in the small intestine, and they are something special about them. On top of villi are microvilli. So not only do we have villi in really big folds on top of every area of the small intestine, we also have microvilli on top of villi. So this is called the brush border. This is the smallest little piece that you can find. So not only do we have finger-like extensions on top of finger-like extensions, there are more tiny finger-like extensions called microvilli. So everything about the small intestine is going to be organized to maximize absorption. There's maximal surface area. All of these sides can come in contact with the digested products, which enter the bloodstream or the lymphatic channels, and that only exists in the small intestine. Okay, so that was my little review for just some basic anatomy and physiology of all the pieces, and then we'll go into the pathology next.